audience about your marks and your rank?
Yeah. Hello, I am Dr. Devankar from Murshidabad Medical College and Hospital. I am from 2018 batch. I have secured an All India rank of 198 in this year Neet PG, and my score is 666 out of 800. And thank you to the organizers for inviting me to this session.
Dada, my first question would be, what is your dream branch and dream college at this point? Like, what are you thinking about?
Yeah, my dream branch was at first my dream branch was medicine, but I changed it to it changed to radiology after I know about my rank. So yeah, I think I'll be choosing radiology.
So your preference is colleges within West Bengal, or you want to go outside?
I think if I got Delhi, then it will be Delhi. If I don't get, then it will be in West Bengal only. First preference will be SSTM, then MCK, like that.
Okay. Actually, there are many second year students in this meet, and there are both new second year and old second year students. So I would like to know, from second year, did you read standard books, or you just did the note?
Yeah, that the second year is the most important year in the MBBS. I think it was the turning point in my academic year. Okay, so from the second year you learn some new subjects which are clinically integrating with other subjects like medicine or surgery. So it's very crucial if you start reading standard textbook from second year itself. I have myself read pathology from Robbins entirely, except the systemic part. Robbins is the one of the best book in MBBS. So try to read it from the first of the second year itself, and solve as many MCQ as possible from second year itself.
Dada, did you read Robbins totally, or did you just read the important parts?
Yeah, if you use any app, then first you saw the video, see the video from any app, Ladder or Marrow, something which you can use, and then you read those textbooks. It will be very easy to understand those textbooks. I read Robbins, especially for the general path and some of the systemic part, and hematology is also very good in Robbins.
Okay, so in second year for micro and pharma, which books did you read?
For micro, I used to read Panikkar. I used to read for micro, and for pharma, I used to read KD Tripathi. Yeah.
Okay.
You can use short books during your MBA exams. That doesn't matter. But try to read standard textbooks from first.
Okay, Dada. From which year did you start your preparation for NEET PG? Like sincerely, you totally put your whole attention into NEET PG. Dada, your video is off, I guess.
Okay. Hello. Yeah. Am I visible?
So, Dada, it is yet not. Yes. Now it is visible.
Yeah. Okay. So I sincerely started during third year. At the first, it was my motto was to just to build my concept and solve MCQs and build to build my concepts more stronger. I did not focus on any ranks or branch as it does. Just keep building.
Dada, your voice is not coming clearly. Can you just?
Hello.
Hello, your voice is a bit not clear. Can you just?
Okay. Hello.
Yes. Now it is audible.
Yeah. So I was telling, so I started sincerely after completing my second year from my third year. I just tried to build my concept from the first itself. I did not focus on any rank or any branch. So it is important to build your concept first. Then, if you you have to be consistent from the second year itself. If you are consistent, then everyone will get a branch in future goals. It is not.
So Dada,
Yeah.
like from now, words are being started, what duties are being started from second year itself. So what do you think, like doing words and doing such clinical postings have any role in getting good rank in NEET PG? Did it help you?
Obviously. Yeah, obviously. Word duties are kept from second year to reduce your stress in final year. If you attend your words from the second year itself, it will be easier for you in final year in internship to manage patients, to manage the clinical scenarios in MCQs. It will be very much easier for you. Word duties are the ultimate thing that you have to do in your life. So that's the most important thing, I think, with your studies also. Yeah.
So you did your word duties from third year itself, I guess. From at your time, it was from third year.
Yeah, during my second year, it was the COVID time at the 2020 and 21. So we used to go into word during my third year itself. Yeah.
Okay. So, you used to attend the classes regularly, or in college, or you skip some of the classes or some of the postings? Like
we everyone know about the college lectures.
Yes.
So yeah, I did not much attend all of the classes except some few teachers. That's obviously good. I used to attend those. And mainly I attend the work duties and practical classes. That's more than sufficient time, I think.
Yes, that
And
means
don't stress over your MB marks. That doesn't matter anymore, I think. If you want a good branch in house of SIP, otherwise it doesn't matter.
Yes, like many of the students are so much focused in their MP exams that they ignore the NEET preparation. Like, what is your view about it?
I in my batch also there are many students who did great in their MBs and now they have not selected in PG. So I think the motive is to build your concept and build your knowledge first. The MB marks doesn't matter at all. The ultimately matter will be where you will get your PG, and the you have to be in a better team and in a better place so that you will flourish in your future. So I think to build your concept is the most important from the beginning of your college year.
Okay. Acha Dada, I just wanted to ask you one thing that in NEET UG times, many of us are very much aware of the marks and ranks that we need to score during to get good college. So, can you give any ideas at present time to get a good branch like medicine or Dharma in good colleges in the MCQ or SSKM? What marks should one target out of 800?
From this year NEET PG, I think the competition has got more. The competition is increasing more year by year. So I think if you are in second year, you will be giving NEET PG in like 2028 or 27, I think. So it will be far more increase by then. So if considering this year NEET PG, I think around 600 marks would be target for a safe zone, I think.
Okay.
Or within 5,000 rank, you will be in safe zone. You will get any clinical seat, I think. For your category, of course. Yeah.
So Dada, the next question is we all know that in fourth year there are so many subjects, and did you finish your fourth year subjects in your third year itself, or you did it in fourth year?
No. I finished only surgery and medicine in my third year, and the rest of the subjects I do in final year. Not all the medicine. half of the medicine I did in my third year, and surgery did in my third year, and rest of the medicine and other short subjects and peds and obsgyne did in my final year.
So, like you finished your syllabus around which time in fourth year?
During my
Like,
final year, about 3 months before my final MB, I think. Yeah.
and during the fourth year and third year, when you are finishing the subjects, were you revising the first year and second year subject?
Not revising actually. I was solving only custom modules of the other subjects. Like patho was my favorite. I did patho all the 3 years from second, third, and fourth final year. And pharma was like a volatile, so I have to keep it revising more than the other subjects. And you can revise format PNTI. It will be okay. Matlab, if you ignore them, then it's okay. We'll ultimately do it. More important is the second year subjects.
Second year. Acha Dada, we all know that there are 5 minor subjects that like psychiatry and radiology. Do you you paid importance to them also during your NEET journey?
Yeah, matlab, when you study for the first time, then you have to watch all the videos. But after then, you just have to practice MCQs and custom modules. That's it. You don't have to pay not much time, I think. If you watch the revision videos from any of the sources, it will be enough for the competitive exam, I think, along with practicing question time. Yeah.
Okay. So, Dada, I would like to ask you what are the some last moment strategies that you apply for getting such great rank?
Last moment strategy, it starts from your second year only. If your basics are stronger, then it will be more easy for you to revise and concise your notes, everything. So actually, I did my I did my concising all my notes during my internship. I tried to concise all of but I could not. So after internship, I tried to concise all the notes and revised it thoroughly. Then it is I think it will be, and most important is the grand test. I will be say, I started keeping grand test from my internship only. So it helped me a lot. I think to rectify your mistakes, it is the most important, along with revising.
Okay. Like Dada, I just wanted to ask, uh, in NEET PG, during internship, we have to all prepare NEET PG. So,
Yeah.
in internship, did you face any difficulties while preparing for NEET PG, like with what duties and all?
Yeah. It was very difficult for us, especially because we had not PGTs in our many of the departments. Like in surgery, obsgyne, it was very hectic, and also in medicine we had 2 actives in a week, so we had total 19 actives in 3 months. So it was very much difficult at that time. So I used to do some custom modules in all the day, so that I can keep myself calm that I have read something, you know, 50 questions or 100 questions all the day. Yeah, that was difficult time, but I think the consistency is the key. I used to do at least 10 or 20 questions every day. That was I think, helped me a lot during my internship.
Okay. I will let Shulagna take over. Shulagna, can you just on your video? Can you answer?
Yes.
My voice is audible?
Yeah.
It is.
So, Dada, what are some of the strategies that you would like to share, like for a second year student, like the normal schedule to prevent some burnout and all that?
Yeah, I think the schedule is personal for all of us. Like I am a night owl. I cannot can study in the morning. So I think it depends on your capability when you can read. Just read when you just enjoy your reading. Don't take stress over it, and just study when you are comfortable with it. I think if you are giving 4 to 5 hours a day, that's more than enough for you now. Watch video for 1 hour, and then read a textbook for 1 hour and then solve question for 1 hour. That will be enough for you at this stage, I think.
What was the coaching that you followed, like throughout your MBBS as well as in your
Uh,
final?
Initially, in my second year, during the mid of the second year, I took Marrow, and I initially tried to write down the notes with the videos, but it took a lot of time. Then I took the printed notes and stick to it and revise it throughout my journey. And I joined TAMS in my third year especially for the medicine, because in Marrow it is so vast, it is not at all revisable. So I read the medicine and short subjects from DAMS and rest other subjects from Marrow, like that.
You mentioned that you were concising your notes. So how were you concising it? Like, were you making your own notes or from the materials that was provided by these
No,
institutes?
that the materials were already provided, and when I did the PIQ, I aware of the important topics and all. So I marked those important topics initially and ignored the rest of the topics. And also they are now providing revision notes as well. So those are the as well very good for your preparation. If not all the notes is not revisable at all for all the 19 subjects. So revision notes is also very good.
Yes.
Yeah.
So did you participate in the quizzes and all that? And did it help you?
I have already participated in more than 200 quizzes, I think, in my whole academic career. Uh, I have I started joining quizzes during my second year itself, as that time was the COVID time. Every college was conducting an online quiz or something like that, and I think quizzing was the most important thing for me to improve my concepts and building the confidence that I can also do some tough questions in limited time that you ultimately have to face in Neet PG. So that is the most important, I think. We should everyone participate in the quizzing from second year itself, because from this time you will be getting confidence that you can also do some tough questions, and also you can integrate with other subjects like that. I attended neurology quiz when I did not have an idea about N of neurology in my second year, and I get selected in top 15. So that's I think it helped me a lot, the quizzing.
Okay, so I will let Shanku Shubro to take over. Shanku, please switch on your video.
Yeah.
Shanku, your audio is not audible.
Yeah.
Okay, am I audible?
Yes,
Yeah,
you are audible.
Dada, please tell your personal experience about the NEET journey. That is it true that one must completely bury themselves in studies during the internship?
No, not at all. I never missed any of my college fest during my academic year. Not only in my college, I had also attended the college fest in SSKM, in NRS, in CNMC, all of the college fest. So it is not at all important to bury yourself in the books at all time. The academic, everyone will get PG at your when your time will come. Someone will get earlier, someone will get it later. But those 5.5 years you get in your college is the most crucial time in your life, and you should not only waste by studying it. You also have to hang out with your friends and also enjoying the college fests, and yeah, just enjoy your life at this time, along with consistency in your study. That's all.
Okay, Dada. And then you telling that one should balance between the study and the
Obvious.
enjoyment
As
in
I
the
told
MBBS
you.
life.
Yeah. I during my internship, as I told, be consistent in your studies. Just read at least one page a day. Just don't waste a day fully. That's the key, I think.
Okay, Dada. Then, what do you think that the concept in second year are for very important for Neet PG.
Yeah, obviously, as I told, it is the most basic things, basic subjects in the second year. Pharma, patho, and micro. They are the base of the clinical subjects. So if your base is stronger, it will be very easy to grasp the clinical subjects in your final year.
So that should we start a completely Neet oriented study from second year?
Not completely, but I think you should start practicing MCQ as early as possible. As you will get more, as you solve the MCQs, you will get more idea about the clinical subjects and the idea of integration of the subjects with those clinically, which I have seen in this Neet PG. The idea has completely changed from the previous year. It has completely integrated and long stem questions in this Neet PG only. Yeah. So if you started doing MCQs more earlier, it will be beneficial for you.
Okay, Dada. Okay, Shanko,
Yeah.
yes, you continue.
Okay, Dada. Can you please tell the correct way of using the online platform that you used?
Yeah, as I told earlier, you first see a video about any subject, like in patho. You first see the video in hematology. Then you read the topic from standard textbook, like if you can use Robbins or Hersman, any of those are very good books. And then you solve the MCQ from Maro or Prepletter, whichever platform you use. Then it will be a completely you will understand the topics as well as the questions. And those questions which you get wrong, keep a wrong notebook with you and maintain that wrong copy. It is much helpful. You'll understand when you are appearing for the exam. I had a wrong copy of around 300 pages, which I revised during my last days of the exam, and it helped me a lot.
Okay, Dada. Now I would like to ask you one thing. Like, many of the students are behind. Like many coachings, they read same subject from Mado. They are not satisfied.
Yeah,
They again go to Preplet and they are still not satisfied. And then like in this way, they make their notes so vast that it is almost greater than even Robin. So what do you think about that? Like revising one thing multiple times and just following one coaching is beneficial, or just running after multiple materials?
Absolutely. Stick behind any one of the faculty. They are the best. Any faculty is the best. They are already there. So follow any of the faculty blindly and revise it multiple times. It will more than sufficient. And if you just make bulky notes for the 19 subjects, it is not at all revisable. It will be only waste of your time. So just stick to one source and revise it multiple times. It will be more than sufficient.
Yeah. Okay, Dada. Like, I just wanted to ask one thing about pathology. Like, you must have known that nowadays in our practical pathology in second year, only 5 to 6 slides of practical pathology are shown. Previously, I guess there were 50 to 60 slides at your time that were there in the practical exam. So, for nowadays students, it becomes very difficult to correlate the pathological images, like they are saying anything about, like they are saying secreting appearance, they are saying like butterfly on wings, like anything they are telling in the book, and it becomes very difficult to correlate and learn practically. So what is about
at my times I also used to identify the slides by the number stickers which were labeled on it. So it is not at all important. Okay. You will get gradually identify it by practicing, as I told previously. So, as many questions as you will solve, you will get familiar with those images, and the pink and HND's training will be come to will be familiar to you. Ultimately, don't take stress on the pathology slides. Yeah.
Okay. Okay, Dada, are pathology images important for NEET MCQs? Like the images, like histopathology images, like pink and blue?
Yeah, obviously. Yeah, they are important. there are at least 30 to 40 questions from pathology, I guess, in this year. But I think, I mean the histopathological images. Okay, so they are important, and you will ultimately you will understand. At first, it will be difficult for all of you. It was difficult for me also in my second year to identify those H&D stain and with all the slides. But as we will practice more MCQs and identify more the pictures, it will be get easy to identify themselves on it in exam also.
Okay. Dada, I just wanted to ask you about microbiology. Reading microbiology is one of the most difficult thing. There are so many culture medias and so many things. So, how did you memorize such vast things for Neet PG and for good second year?
I did not memorize bacteriology at all, because bacteriology is the most fast and most low yielding subject in microbiology. If you can, if it is also a note to eliminate the options. In my bacteriology, I used to eliminate the options, and then I took a guess between two options, and it may be correct or may be wrong, but I did not bang my head over it, because in microbiology, more important is the mycology, parasitology. These two are the most important, and also general microbiology. Don't bang over your head over the minute details of bacteriology. It is the most low yielding in microbiology. And learn to eliminate the options as well. It will be helpful for you.
Okay, that are now it is all about microbiology. Now, in pharmacology also, sometimes the name of drugs to remember it becomes very much difficult. So, what are the systems in pharmacology that you would like to tell everyone that is important for NEET PG?
Pharma is, it is a volatile subject. It took me the maximum time to read the pharma and revise it. So you have to start earlier to finish the subject and revise it multiple times. Otherwise, there is no shortcut in pharma. You have to ultimately remember the names and at all. You can use the mnemonics which are available in first aid book, or in all the faculties use some mnemonics. You can use it. It will be useful.
So, Dada, another thing just I wanted to know, nowadays FMT and ComMed are included in the second year SAMES, and although the AP exams are in the third year, but there's in SAMES ComMed and FMT are asked. So, did you start using ComMed and FMT in your second year, or you did it in
Not
third
at all.
year?
Not at all. I did ComMed in my third year at last 2 months. I did not like the subject at all. So don't take stress over it. And if you watch the revision videos of any of the source, you will ultimately understand the comment. It is only the and nothing to understand. It will ultimately be easy, not at all difficult. Yeah.
Okay. Did you read parts or just PYQs?
No. I did not even bought the part. I used saw it in my library 2-3 times, and that's all. I used a smaller book like Vivek Chain and give my MB. Yeah.
Okay, Dada, in medicine and surgery, what books did you prefer, and how did you balance between videos and the books? Can just
Medicine, actually the notes is itself sufficient, but I used to use those book by the Ramdas Naik and Archit Balur. That book is very good. And all for surgery, I used to study SRB. That is also very good. SRB or Manipal, any of the book is good. Uh, Textbook is not that important, but you can read for the weak topics, or if you don't understand by watching the video, then you can use the textbook.
so, Dada, in your time, you mostly focused on notes for medicine surgery.
Yeah. I usually focus the notes on for medicine and surgery, and also for PIPs also. Yeah.
Okay. So, Dada, the last question that I like to ask you is, what are the subjects that one cannot miss out for Neet PG, and like what are those subjects?
As I told earlier, second year subjects, batch pharma micro for your futures.
Thank you, Dada. Okay. Thank you.
Yeah.